my name's Ian Welsh, and in this short presentation I'm going to look at how mentors can take stock of the learning opportunities which are available to their students in clinical placements and how these can be maximised. You could, of course, just leave it to luck. Students learn by osmosis. They'll just pick it up. There's plenty going on, they must learn something. Or you could ask them to go and sit next to Nellie. Nellie being the person who's been in the department for a long time, has done everything, knows everything. Unfortunately, Nellie may not be a very good teacher. So let's just take a little look at curriculum theory. A curriculum is a structured program of learning opportunities and assessments. That's all. Any clinical placement can develop its own mini-curriculum to complement the university's curriculum, but the key word in all of this is structure. To start with, it's important to know what the clinical learning objectives are of the student. When students come into placements, they should have a clear idea of what it is they're there to learn. So you need to know, what does the student need to know? And then how can you match this with your own educational resources? So let's think. What do you have to offer? Well, there's staff with specialist expertise. As a mentor, you don't have to do all the teaching, but you can arrange for your colleagues to teach. So people with experience, skills, expertise in particular topics can be delegated to teach your students. And what about your colleagues in the multidisciplinary team? Why not use them? Are they willing to let the students observe what they do? Are they willing to teach the students and perhaps even let them participate in therapeutic activities? Can you develop a stock of library articles and books and journals, or maybe some visual aids, pictures, diagrams, maybe anatomical models? Does your student have access to the internet whilst they're on placement? Can they use the intranet to obtain relevant information? Can they surf the internet to find information on any topics that they're currently considering or having experience of? Simulation is possibly an important thing to consider, particularly for complex clinical skills which it would not be safe for the student to practice on real patients. And what about allowing the student to go off the department, to follow the patient journey, as it were? So when the patient goes for special investigations, therapeutic procedures such as surgery, why not let the student follow the patient so they get an overall picture of what goes on? It's important to evaluate your learning opportunities. So how effective are they? And one way of looking at this is to consider the resources. Consider the human resources, the staff that you're using and the range of expertise they have, and the materials, the equipment, the teaching place that you use. And then look at the processes. This is actually about what's going on. So how are the resources being used and are they effective? It's one thing to have staff with a range of experience, but if they're not willing to teach or they're not good at teaching, then we need to think about how to improve that. And one way of finding out how effective your resources are is to look at the outcomes. How is the student learning? Has the student learned? And what is the quality of the student learning? So in summary, leaving learning to chance is not an option. Planning learning experience is better. Planning involves knowing what the students are expected to learn while they're with you. And a systematic evaluation of your program may result in a clinical learning environment which is to be envied.